Welcome to week 2 of HIM115 Medical Records and the Law. And I'm so glad that you were able to join me today. Um, this week, we have a couple of different things we're going to talk about. And the first is HIPAA's privacy rule. The discussion is going to be about HIPAA's privacy rule. Two things I want to point out. First of all, it's HIPAA, one P, two A's, HIP HIP Okay. All right, now the more important thing is the privacy rule. Regardless of what your role is in healthcare, regardless of your title or your job description, you will have to know and understand HIPAA's privacy rule, and you will have to understand how to comply with this rule. In addition to it being very expensive to violate HIPAA, and of course, there's always the potential jail prison thing. The fact is it's wrong for us to violate a patient's confidentiality. And that is our obligation to our patients to make sure that we respect them. Now, it's in its essence, HIPAA is, you all know about patient doctor privacy, confidentiality, right? It's been around since forever, since the Hippocratic Oath, which I think was in the 200s, so almost 2,000 years. And what that says is whatever someone tells their physician must be kept quiet. It is an obligation, both ethical and legal, of the physician to never reveal what the patient has told him or her. And if you've ever seen Law and Order or any other legal drama in the movies or on television, or if you've ever been in a courtroom during any kind of proceeding involving this, a physician cannot be forced by the court to reveal what a patient has told him or her. So what does that have to do with HIPAA's privacy rule? Well, back in the year 200, when Hippocrates was getting the whole ethics thing for physicians put together, it essentially was the patient and the physician. But now in 2020 and beyond, 2021, we have so many more people who are involved in and able to read about or know about the patient's secrets. So HIPAA's privacy rule has taken doctor-patient confidentiality and simply expanded it to include the front desk people, medical assistants, nurses, radiologists, health medical coding professionals, health information management, anyone and everyone on the healthcare team must protect the patient's confidentiality, protect the patient's privacy. And there are very specific rules that exist that tell you when you may use your good judgment or, in the eyes of the law, actually go ahead and divulge something. Other than that, it's keep your mouth quiet. It's not your business to be putting other people's business anywhere, in a restaurant or on the street, okay? It's also not your job to get in between a husband and a wife or a parent and a child or any other personal relationship. Not your job. And, you know, it's hard enough when things are going on in your own family. You don't need to be getting in the middle of somebody else's family, that's for sure. Okay? Your job is to keep the patient's information protected, private, and do your job as your job requires. And it does not require you to talk to anybody who walks into the office or the hospital asking for information about a patient. You don't know what's going on between other people and other people. Okay. Now it's natural to think, well, I have a happy marriage. I share everything with my husband. So this husband coming in to ask about his wife and to get copies of her medical records because he's doing her a favor. Well, that's really sweet, isn't it? Why would I want to deny him that opportunity? That's a very nice thing. However, he's not going to tell you, and you're not going to have any way of knowing that they're actually in the beginning of a very bad divorce and child custody battle. And the only reason he wants you to give him those records is so he can use it against her in court. You don't know that. You would have no way of knowing that. You don't want to do that, do you? It's not your business. So now, one thing I also want to point out, which I think is very important, is that a mistake that a lot of facilities train their people to say. And what I mean by that is there are facilities that might train you that if you're working the front desk or somebody comes into the HIM office and, after the pandemic, when people can actually walk into your office, when you can actually walk into your office. Okay. But anyway, somebody walks into your office and demands a copy of their records or a copy of their mother's records or father, whatever. Okay. And you say, I'm sorry, I can't release those without written permission from the patient himself or herself. And the person gets angry. There are facilities that will tell you to say, I'm sorry, this is our policy. I cannot release them. In my experience, that only makes people mad. I don't want you to do that. I want you to explain to them why you cannot release them. I want you to explain briefly that, well, you see, it's federal law to protect everyone's privacy. You would want me to protect your privacy, right? Your personal information. So the law is written to protect everybody's privacy, and we don't get in the middle of families. So I need to contact the patient and get her permission or his permission to release them in writing, and no problem, I'll be happy to help you. Do you feel the difference between explaining that and actually educating the person versus, I'm sorry, it's our policy, I'm not allowed to do you?
Now we have that. I work in the ICU, and we give Clarendon gives out a passcode, which is usually the last four of their encounter number.
Mhm.
Um, so when they call and want information, we have to let them know that we asked for the passcode. If they're unable to give a passcode, then we're not at liberty to inform them whether that patient is there or not.
That's right.
But like for instance, Prisma to me, they stopped giving passcodes and
Really?
passwords. Hmm. You can call and ask for any patient. You can call and say that you're trying to find out how your mom or your dad or whoever, or you calling to find out how they're doing, and that nurse can let you know how that patient is doing. They don't give a passcode anymore at Prisma Health to me.
Okay, I gotta tell you, that's a violation of
I
HIPAA.
know we the only thing that comes into conflict with during this pandemic is that a lot of people come by ambulance or without family.
Mhm.
and family is not given, or especially the patient ends up getting vented in the intubated in the
Yeah,
ER, they are not at they haven't been able to give the passcode
right. Because 'cause they're
to
not there.
because they're
Right.
not there. So at that point, we have to contact our supervisor and the chief of staff at the hospital. Well, Dr.
Well,
Raven,
that's
she
better. That's better, and you know what? It is understandable during the pandemic because of COVID that there has to be a little bit of latitude because exactly as you said, somebody comes in by ambulance and then they're vented. They don't even have a chance to tell you, yes, it's okay to talk to my daughter, you know? So I can understand that. But I like the fact that you have to then go talk to your supervisor or somebody who can vet and find out who that is on the phone. Okay.
yeah. Now,
And
if the patient can talk,
well, then
um,
that's a whole nother
yeah,
that's a
then
whole nother thing,
we
right?
have to the nurse will go, especially COVID rooms, the nurse will go in and say that we have so and so on the phone. They're your daughter or whatever. But if that patient has a cell phone, we'll tell them to call that cell phone.
That's
And
good. That's good.
while the nurse is in the room and the patient family calls, at that time you can give permission, and then we'll give the code
Yes,
out.
because that's actually written in the law. It says that you can do that as when the patient has the opportunity to verbally object or agree. Okay. Same thing in a doctor's office. You have a patient coming in for test results. Okay. And let's say a husband and wife, and the wife comes in, the husband stays in, is told to stay in the waiting room. The doctor can say to the patient, would you like your husband to join us and I can explain it all at the same time? And the wife has the opportunity to say, yes, I would love it, or no, let him stay in the waiting room. I want to keep this to myself for right now. You may say, well, husbands and wives should, don't you want to share? But again, we don't get into other people's relationships. I mean, for gosh sakes, being in a relationship is hard enough when you're one of the two people. You know, we don't need to be getting in the middle of other people's marriages and whatever. So, yes, you are absolutely right, Nikki. That's excellent. That is actually written in the law, in the privacy rule, that says when the patient has an opportunity to agree or object, you don't need to get it written down because the patient is right there, and they can do that verbally, and that is exactly right. Now, remember, you have to give the patient the opportunity to say yes or no outside of the hearing of the other person. Okay. So whether if it's somebody on the phone, you put that person on hold. You don't, hold the phone and put your hands over because that doesn't work with digital, right? And right. And you certainly don't ask in the room. Okay. So there are certain things now, if you will make note, excuse me, if you will make note, if you Google HIPAA's privacy rules summary, you can download, and I may have already put it into the course, excuse me, into content for this week. Um, excuse me. Um, if you do that, you will find the summary. It's only 6 pages long. It's very easy to read. I use it as a handy thing to keep me refreshed on the details of the privacy rule. When you can make a judgment, there are 6 situations where it's not an absolute yes or no from the law. You use your professional judgment, but they're very specific 6 situations. Okay. So if you make note to do that, And I'll try and remember to do it and maybe post it in announcements if I didn't already put it inside the course. Okay. So this is very important. So our discussion this week is for you to analyze this case scenario. Dr. Horton's documentation is incomplete and the diagnosis does not match the procedure provided. You query him and he tells you to change the diagnosis code to whatever the patient's insurance will accept, so they pay for the procedure provided. This is not the right thing. This is a fraud case. This is not HIPAA privacy rule. Huh. Okay. He explains that she would not be able to afford the procedure otherwise, and she really wanted to have the procedure at this time. He tells you that it is only fraud technically, and we are doing the moral thing for the patient. What should you do? So this is an ethical question, which goes along with your reading. It's really not about the privacy rule. But what I want you to do is think about your ethics, what is right, what is legally right, and what is ethically correct. Okay. And this is important because things like this happen every day. And there are people who will have different ethical standards than you have. There are people who have been brought up with different, this is what's right and this is what's wrong. And you need to confirm what your standards are with regard to your job. And I will tell you this, I'm old and I have seen it proven time and time and time and time again. What goes around comes around. I see you nodding. It's true, true, true. It may take 10 minutes, it may take 10 years, but I promise you what goes around comes around. So if you agree to let somebody influence you to breaking the law, and maybe more importantly, breaking your ethical code, here's what I want you to think about is, will a doctor who's asking you to break the law have the character to stand up when the police come and say, oh, no, 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 don't take her to jail. I told her to do it. I threatened her. I told her I'd fire her if she didn't. You think he has that kind of character? No. This is the kind of person who's going to say, hey, I don't know anything about coding. That's why I hired her. She's got the expertise. She's got the certification. She knows these things. I don't. That's the kind of character. And yes, it's very scary because nobody wants to lose their job. But going to jail is not as much fun as you might think it is. I don't think it is. I don't know. I have actually never been in jail. Thank God. I hope that never happens. Toy, toy, toy. That's my grandmother used to do. Okay. The point is that this class gives you an opportunity to actually look in the mirror and see what kind of person you are and build up the strength of character, because it does take a lot. It takes a lot to be able to stand up and say, Dr. Horton, you're my employer. I appreciate that, but I'm sorry, I cannot break the law. I cannot report the wrong codes because this is fraud and I just cannot do it. That's it. If he wants it done, let him do it. Or you say, you know what? there's a pandemic out there. We have incredibly high unemployment. I'm so thankful for this job. I can't afford to lose this job. So I get this woman a free procedure. I'm helping her. It's a good thing. It's a charitable thing, right? This the justification part. Okay, right? And I'm sure we won't get caught. We're in this little doctor's office or this hospital in South Carolina. Nobody's going to pay any attention to us. It's fine. Nobody will know. I also want to tell you about guilt, okay? Because the fact is, if nobody else knows, you will know. But I am not going to tell you what's right or wrong. You have to decide that for yourself. But it takes practice and it takes strength to stand up to pressure of this nature. Okay? All right. Now you're going to be reading about making ethical decisions in chapter 2. And so the discussion that discussion scenario actually connects to ethical decision making as opposed to HIPAA, but the point is you need to know it all, so it doesn't matter. All right, I want you to be prepared. It is a wise woman who knows and prepares for the negative as well as the positive. Now, of course, my good hopes, my strong hopes are that you always work for somebody who is ethical, okay? But you look at what Nikki said is going on in the Toomey Hospital now, and that is at the very best, what they're doing is borderline with regard to violating HIPAA. And the truth is if you are the one that tells somebody out of turn about a patient's condition to just somebody on the phone, and somebody complains, they're going to be complaining with your name. Mm-hmm. And then it's going to be you having to defend yourself in front of the Office of the Inspector General of the federal government. So, as hard as it is, and I know this, it is hard. I want to help you steel yourself and help you get a little stronger. Sometimes you will be in an economic position where you can say, not that I'm rich, okay, but I'll rather go work at McDonald's than give up my ethics and my integrity, okay? That's an incredibly freeing position to be in, okay? Plus, you work at McDonald's, you get free hamburgers and free Egg McMuffins and chocolate shakes. Wait a minute. This might be better than teaching law and ethics. Oh, I got to look into that. No, it's not. Besides which, I'll end up being 600 pounds. Okay. I won't be able to get out of the house to go to work. All right. Because I'm pretty sure you can't work for McDonald's from your home. Right. No, you can't. Okay. All right. I say that, and that's always been my go-to saying is I would rather go work for McDonald's than to deny my integrity. But again, I'm old, okay? I'm a little more established. I might have greater economic freedom. This is not something I can teach you how to be stronger. I can teach you how to think about your options. I can help you because, I'm your teacher for life now. So I can help you even get a new job as best I can. But I cannot make a decision for you because this is too personal. Okay. But this discussion forum and these readings the reason this course is required is because it's important for you to at least know for a fact that you're making a choice to do something illegal and you could get caught. Because I'm pretty sure there are thousands of people in the penitentiary that think they would never get caught. I'm pretty sure of that, you know. So again, I'll give you the facts. You make the decision for yourself. And it's not even necessarily a decision you can make right now for the whole rest of your future, because things change constantly. And we are in the middle of a pandemic. But the fact is that I would love you, Nikki, to file a key tam lawsuit against Toomey for these HIPAA violations. But the fact is maybe now is not the right time because of COVID. Maybe it is, you know, I mean, okay. The point is that I'm here to educate you. You make your decisions. I stand by you no matter what. Okay. All right. Any questions so far? Okay. Then of course, after you read the chapter, you do the discussion board, which is good to get your brain cells all going juicy and thinking about stuff. And then you got to take your quiz, review, test, whatever it is. Okay. All right. And the homework, you do this every time. So every week, it's the same exact thing. All right. Okay, this week I love this. Yes, I did post in the course 7 steps to ethical decision making, which is a great handout, so you might want to print it out or at least download it and keep it in your stuff. But I want to tell you also, in the course is linked, it's free movie on YouTube. It's only an hour and a half because it was originally a Lifetime movie, Lifetime, the TV station. It's called Baby Girl Scott. It stars John Lithgow and Mary Beth Hurt. It is the perfect movie to talk about ethical decision making in healthcare. And it covers so many different things, and it really helps you get an understanding of a real life, and it is based on a true story of real life, how ethical decision making does get involved in healthcare so often. It's really a very well done movie, and I strongly recommend that you find the time to watch it, and let me know if you do. Okay, it's from 1988 or 89, but don't let that put you off, because it's still very appropriate and it's still an excellent example of ethical decision making in healthcare. I also want you to watch out. There's a scene where John Lithgow, who's the father, it's about a baby who's born prematurely. That's baby girl Scott. Okay. Their last name is Scott. There's a scene, and it's really quick, where John Lithgow is called into the business office of the hospital because they want to talk to him about the charges that's being racked up as his premature daughter is in the NICU and just had surgery. Okay. And the office guy says to John Lithgow, I need to talk to you about, we need to make some arrangements for the payment of the bill. And he says, oh, there's no worries. I have really good insurance. And the guy says, well, yes, but it has a $50,000 cap. which is that's the maximum that the insurance is going to pay. And John Lithgow looks at him and says, well, the baby's only been here for like 2 days. And the guy says, yes. And at this moment, the bill is $75,000. And this was in 1988 or 89. Okay. The point I'm making is that's our side of the building, if you will. Health information management, medical coding. You may or may not be involved in billing or accounts receivable, which is that gentleman is those are the people who have to go get people to pay their bills and pay the facility what they owe. But even if you're not, it's very eye-opening, because we have to realize that with all the wonderful innovation and the equipment and the skills and the different methodologies of procedures that are available, somebody's got to pay for all of that. And if I'm not wrong, you guys are going to want to get paid after you graduate, right? Or even for your current job, right? Yeah, okay. So, and that's only a part of it. Your own salary is a part of it, but you look at all the people that are involved in caring for a patient, even in a doctor's office, plus the overhead, the utilities and the phones. You have it in your own house. You know how expensive it is to live just yourself and your family. Now imagine having all these people, all this equipment. Okay. So, but more importantly, Baby Girl Scott is a wonderful movie that is perfect when we're talking about ethical decision making in healthcare. So, and it's very well done. So I hope you will take the time to enjoy the movie. Please give me a quick email if you do, because I'd love to know what you think of it. And it's free on YouTube. So seriously, why not? Okay. Any questions? No? Okay. You know how to get me. Email. I answer my email every day, 7 days a week, rain or shine, holidays or not. Happy Martin Luther King Day yesterday. And have a wonderful evening. And I am here to support you. Even if it appears that sometimes I don't know what I'm talking about, I always know what I'm talking about. You just may not know what I'm talking about, but eventually we'll all figure it out. Okay?
Yes.
Okay. Have a good one.
Are we
Yeah.
meeting tomorrow for 2:50?
Yes.
Okay.
Would you like me to change the time?
I'll listen. I had a new phone, so I was trying to get it hooked up to the car. So now I have it hooked up to the car. So
I
I'll
can
be
move
able
it to 12 noon. You want me to move it to 12 noon?
not if it's going to interfere with everybody else.
I don't know about everybody else. All right, I'll make an executive decision tonight, and then tomorrow you check it and see. Maybe it'll be at noon. Maybe it'll be. Wait, now I can't remember what I told Jennifer, because Jennifer did email me a question about it. All right. It'll be 6 o'clock tomorrow. You figure out how to use your car phone, or your car in your phone, or your whatever. And I think maybe starting next week we'll switch it to 12 noon. So wherever you
Okay.
are, you
And
can.
did you look over the reviews that we have to submit?
Not yet.
Okay.
Yeah. I'm sorry. It was a very busy day today,
I understand.
but I will. Okay. I gave you your points for the discussion board, so that was something, right?
Yeah, it was because after what it was is that they had them real close, so I couldn't see what other people were I didn't see the threads. So I
Oh,
had to,
you know what? There's a way to switch that. Um, and just contact technical support. They'll tell you there's just a little thing that you click. I want to say it's in the upper right hand corner. And you just click and it will change the way you see the discussion forum.
yeah. So after I
Okay.
pulled it down,
Yeah.
and then I saw everybody, I was like, oh, thank God. So, because I'm like, well, how in the world?
Right, I understand.
Yeah, because I
I
didn't even know
understand.
mine went because I couldn't see anything. So I was getting ready to do it again. I said, nope, email, Nikki, email. Dr.
Email.
Tiffany
That's
said,
right.
email.
Email.
So I
Uh,
emailed.
Excellent. Christina, you have any questions?
No, ma'am, I'm good.
Okie dokie. Have a wonderful, wonderful evening.
You
And I
too.
will see you in the discussion boards and I'll see you tomorrow night.
All right, you
Okay.
too.
Bye.